G2000. Work hard, get back.
You're with Channel 4 and joining us today is Dr. Julio Gomez-Seco from the NMC Hospital DIP in Dubai, here to talk to us about asthma. So, Doctor, please tell us, what is asthma?
Asthma is a chronic disease of the lungs.
Okay, and can you tell us the symptoms of asthma?
When this happens and the tubes start to be narrow, then the patient will start feeling some difficulty in breathing, mainly felt as chest tightness or heaviness in all the chest around. Also, the patient will complain when trying to run or trying to do exercises, will feel a shortness of breath that could be more or less severe. And also, that used to be very dry cough, worse at night.
Right, and how can asthma be diagnosed?
First of all, with the symptoms. If the patient is having the typical symptoms, we have to consider asthma, but also the asthma not always is coming with all the symptoms, can have the symptoms. So we have to also go for evident objective tests that give us clue of the diagnosis of asthma. We can also go for other tests very helpful in the support of the diagnosis, which is called nitric oxide, made in the tubes. Because of this inflammation of the tubes can be raised, that also can give us more support of diagnosis.
Can you tell us what can worsen or uncontrolled asthma?
Any kind of respiratory infection, common cold, sinusitis, pharyngitis, bronchitis, or pneumonia, whatever the infection, respiratory infection you have, then your asthma will be triggered. Also, other factors is any irritant, some perfumes, bleach, chemicals, also smoking or fumes. This can worsen asthma, mainly aspirin, or painkillers such as ibuprofen, Voltaren, diclofenac.
Okay, and how is this treated? Is this treatment forever or is it a curable disease?
Unfortunately, it's not a curable disease. It's a chronic disease. Once the onset of asthma starts, then will be forever. You have two different medicines. We have controller medicines and we have of maintenance medicine, or another which is for emergency or rescue medicine.
And if you have asthma, what do you do if you don't follow the treatment and the regular FU assessment?
The asthma will be easily controllable and also will give us normal life. Then we can enjoy our normal day by day. The problem is if we don't treat the asthma properly, we don't care about the asthma, we leave the asthma not being under control, then the asthma will make a chronic deterioration of our tubes gradually, very gradually along all our life or along several years, and then give us very bad quality of life. But all this can be prevented if we do things properly. The patient is follow the advice to be followed regularly, to assess lung capacity regularly, to assess how is the control with the symptoms, and to check how he's taking the treatment, if he's doing fine, and any concern to be clarified by the doctor, the primary physician.
Appreciate all your advice. Thank you, Dr. Julio Gomez-Seco from the NMC Hospital DIP in Dubai, and coming to join us on Channel 4.
Thank you very much.
Smiles by Etisalat, the new programme with tons of deals and rewards. Download the app now.